Well, hello everyone, dear colleagues. I'm Chao Gao from China, and currently I'm located in the first affiliate hospital of USCC in Hefei, China. I have to say it's quite difficult for me to choose the most interesting one, because on the first day afternoon, the opening ceremony, Professor Thomas Lusher has showed that there's like 20 New England paper, 11 Lancet, and 13 JAMA papers. I think all of them were quite important. I have to say I didn't have the chance to go over all the hotlines and all the late-breaking sessions to have the first-hand experience, listen to all the investigators, but definitely I'm going to download all these papers, including those published in Circulation, JACC, and European Heart Journal to see what's the latest news on the field of cardiology. But for my own interest, because I'm an interventional cardiologist focusing on coronary artery disease, and we're also doing our own trials focusing on the recently published data for like REAC K3 2, and that's a DCB trial. So if I have to choose one most interesting for myself, yesterday the DCB versus POVA on the PVAT were quite impressive and astonishing for me, because DCB did not show any benefit compared to PDCA. And I think the most interesting one is that the discussion gave the investor quite a difficult time, a lot of questions raised, and really help us to how to interpret the data and see the future direction, how we do clinical practice and research forward. Or I have to say, the treatment for HCM is like breakthrough for all of us in cardiology, the mavacamten, aficamten, and really it's the first disease-specific targeted therapy for HCM. I think there's a lot of work to do, and I'm sure there will be good results, hopefully, and to have the chance to better cure our patient with HCM. There are a lot of important sessions and data regarding the medical, but the main takeaway for me as a young investigator and practitioner, I have to say, also the data presented by Professor Thomas Lusher on the first day, there's 1,200 abstracts submitted from China, around 700, if I'm correct, were accepted, but the most important data, there's only 2 Lancet paper, if I'm right, from China. So I think a lot of work to do. There's a lot of young investigators would like to do research besides clinical duty, but I have to say, there's quite a lot of room for improvement. We need to gather around, work in collaboration to gather more high-level quality data in order to provide the medical society how we can treat patients, if not only in China, but also worldwide. I think the collaboration and the communication is the most important I have learned and takeaway, because there's a huge population and patient numbers in China, and we're not doing a fantastic job. We have to move forward and work even harder.